Hi, Ms. Peschke. How are you?
Good, how are you?
Good. My name is Riley, and I'm a nursing student at Oakland University. So today I will be doing an inspection of your hair, skin, and nails, as well as checking out your eyes, ears, and nose.
Okay.
So before we get started, wash my hands. So do you have a history of skin disease?
No.
Do you have a history of skin cancer?
No.
Does anyone in your family have a history of skin cancer?
No.
Okay, and then do you have any issues with your hair or nails?
No.
Okay, and then currently, have you noticed any changes in your hair lately, like thinning or losing anything?
No.
Okay, and then have you noticed any changes in your skin, like itching or rash?
No.
Any moles that have been changing?
No.
All right, and do you have any headaches?
No.
Okay, any dizziness?
No.
And what about neck pain?
No.
All right, and then hearing loss?
No.
Okay, so when was your last eye exam?
About 6 months ago.
All right, and then do you wear contact lenses or glasses?
Contact lenses.
Are they disposable or are they one-day use?
Yes, disposable 1 day dailies.
Okay, and then do you ever sleep in them?
No.
Okay, do you have a history of hearing problems?
No.
Okay, great. So next I'm going to check your level of consciousness. So do you know what day it is?
It is September 24th.
And do you know the time?
About 6 p.m.?
Okay. And then do you know where you're at right now?
Yes, I'm at the hospital.
And then do you know why you're here?
For a checkup.
Okay. So that means that you are alert and oriented ×4, which is good. That's what we want. And then you're 39 years old?
Yes.
Okay. What gender do you identify as?
Female.
Okay. So next, I'm just going to be looking at your skin here. Everything looks even. I don't see any discoloration or lesions, no moles of concern. So I'm going to have you lay your arms out like this. I'm going to go ahead and check the temperature on both sides. So you are an even temperature on both sides, and your skin is soft and dry. And then I'm also looking at your facial features. So your face looks relaxed, it looks symmetrical, your speech is good and clear, you're dressed appropriately for the occasion at the hospital, and you are well groomed and hygienic. I don't see any physical deformities on you, so that's good. And then I'm going to move on to checking out your head. So I'm just going to feel here. Okay, your head feels normocephalic. Don't feel any lesions or any bumps on here. Can I take your hair out?
Yes.
If I can. We'll just go for the ponytail. Just so I can check the full length.
Okay.
There you go. And checking out your scalp here. Everything looks even. Your hair is all a dark brown color. Don't see any abnormalities here. Your skin looks healthy there. Your hair looks soft. It's not brittle. It's nice and healthy. So that's good. And then next I'm going to be looking at your eyes. So they look symmetrical on your face. They are aligned in your eye sockets well. Your eyebrows are even. I don't see any patches. All the hair looks evenly distributed. And your eyelashes, you do have makeup on, but I can tell that your eyelashes come straight out and they curve up, which is what we want. And your sclera look a little red. Do you have allergies?
Yes.
Okay. So there's just some redness, but then they're mostly white. And then I'm going to look at your conjunctiva here. So I'm going to touch the bottom of your face, so go ahead and look up for me. Okay, and then go ahead and look down. So your eyelids on both sides look pink, they look moist, so nothing there. And then I'm going to have you shut your eyes for me. Okay, so your eyelids approximate completely, which means that the top eyelid and the bottom eyelid close completely when you shut your eyes. And next I am going to be looking at your ears. So do you have any ringing in your ear?
No.
Do you have any ear aches?
No.
Okay, any hearing loss that you're experiencing?
No.
Okay, so is it okay if I touch your ears?
Yes.
So I'm just going to be looking here for any discharge. We don't see any. Alright, they look symmetrical. They all have the same shape, good size. Now I'm just going to start up here and feel all the way down. Do you feel any tenderness when I'm touching them?
No.
Okay. Next, I'm going to be looking at your mouth. So do you have any toothaches?
No.
Do you have any sores in your mouth that you can feel?
No.
Any difficulty swallowing?
Mm-mm.
Okay, good. So I'm just going to look at your mouth here. You can go ahead and shut it for now. Your lips look pink and they are moist, so that's good. No sores, no cracks or anything. And then I'm going to have you open up your mouth so I can take a look. Alright, so your teeth are all white. You have all of them. I don't see any yellow or any abnormal coloring. Your gums are nice and pink. I don't see any receding. There's no sores on them. And then I'm going to look at your buccal mucosa, which is your cheeks. Alright, nothing there, so that looks all good. And then I'm going to have you stick out your tongue. I'm looking at the midline here. It looks good. And then flip up your tongue. Alright, so both sides of your tongue look nice and even toned. I don't see any lesions or anything on there. And it is all moist. And then next I will be looking at your neck. So, do you have any neck pain or any limitations in your range of motion?
No.
Do you notice any lumps or swelling in your neck?
No.
Okay. I'm gonna go ahead once this dries. And I'm just gonna take a look here. So your head is in line with your neck. It looks symmetrical on both sides here. Your trachea is midline. And then I'm just going to go ahead and feel all of your lymph nodes to make sure that I cannot feel them. And then is there any tenderness when I'm touching anywhere?
No.
Okay, I could not palpate them, which is good. And then I'm going to have you touch your chin to your chest. Any issues there? Any soreness?
No.
Okay. And then I'm going to have you look all the way up at the ceiling. Right, and then I'm going to have you look over to your left shoulder. Okay, and then go ahead and look over to your right one. Right, you can then touch your left shoulder to your left ear. And then do that on the right side. Okay, good. So you have full range of motion. And then last thing I'm going to be looking at is your nails. So they're smooth, they're all an even color. Your nail bed is pink while your nails are white, which is what we want to see. They're straight. You don't see any rough edges, any brittleness or cracking. So now I'm going to look at your profile sign. And that's good. That's about 160 degrees. And then we'll be checking your capillary refill. So I'll just take one finger here. I'll hold it. Good. And then I'll take one on the other hand. Good. Good. So the blood came back very quickly, which is what we want to see. Good. All right. So I am all done with my exam. I think I have everything that I need. So before I go, do you have any questions for me?
None that I can think of right now.
All right. Perfect. Well, thank you so much.
Thank you.
Have a great day.
You too.